Compass. And for those who are just joining for the first time, just a little recap on what Career Compass is. Career Compass seeks to be a guide, just like the name is compass. It's used to direct people on what career path they should go. We're in a system and a world right now where it looks really like, okay, there are some top courses and there are some courses that if you're not doing a course. Meanwhile, you see, this is you burning with a particular passion, but because you feel like, okay, I cannot get enough of what I need in this course, you feel like, okay, let me just look for maybe the top professional courses, right? So in Career Compass, we delve into the various opportunities present in these different career opportunities we see in the university. We let us know, okay, this is what is really inside. We try to kill the stereotype. Okay, we've looked at mass communication, we looked at psychology, and we did our best to kill this stereotype. All right, so there's so much more in every course than it is just generally known as. Like, I will always use mass communication as an example. Over the years, it has just been known to be a course for presenters, TV presenters like me. Meanwhile, through Career Compass, we were able to see that there is so much more to offer in this course. All right, so based on popular demands, we have where to focus on today, and if I am not mistaken, it's already on your screen. But today we're going to be looking at career path in medicine and surgery. Yeah, so usually at the end of every program, we make sure that we leave the door open, we keep the door open for as many who would just, it's now left to you to vote. It's left to you to just drop your suggestion on what course you would want us to talk on in the next session of Career Compass. Okay, so if you're here with us, kindly hit the like button, hit the love button, engage in any way you can engage. Also, let us know who you are, your name. If you're in the university, let us know. If you're on that, if you're a fresher, let us know. If you've not even entered, you're aspiring to go in, also let us know. You can also let us know your university, where you're streaming live from, and yes, that would do us a very, very, very good thing. All right, keep engaging, keep sharing this content for as many people who you know would be interested in this. Today we're looking deeply into career opportunities in medicine and surgery, like I said. So let's delve in. Okay, the first thing I really want you to know about medicine and surgery is that medicine and surgery is one course which never goes wrong. All right, for as many persons who know what they studied, for as many persons who studied well, you would hardly ever be stranded in such a course, except maybe you don't maximize opportunities. Okay, so we're in a system where opportunities are laid bare day after day, but it's also laid bare for as many who are willing to maximize it, for as many who are willing to ask questions, for as many who are willing to know, okay, what's happening here? Do you understand it? So if you're a medical student, I really don't think you should go through this long process of medicine, because medicine is one of those courses, right, that spend more years in the university, and even after all of this, they still have to go through the internship program. Do you understand? So this is one beautiful thing about medicine. So there's a lot of professional training in medicine that you should not just drop. It's not a certificate to just drop to pick up any other thing. So anybody venturing into medicine must be sure this is what you want. All right, because you won't pass through the rigors of a medical school, and in the long run, if you are looking for you in the field. Okay, so before we delve into the major career path in medicine and surgery, I want to let us know something. Yeah, so I personally focused on those parts which I know are, will I say, popular. When I mean popular, generally maximized and generally accepted in any economy you find yourself, right? I did not go to get some other part which I know that would only really be needed in maybe very developed top countries, first world countries and all of that. I went for as many parts as you can find even in a country like Nigeria, right? I believe that's just the best way to be realistic about this career path. All right, so before I say more about all this part, I want to let us know that yes, Beyond these parts, there's also the part of lecturing, like I would always say, and research. But we're going to go back into it. So the first on our list today on career path in medicine and surgery is cardiologist. Okay, so who is a cardiologist? You must know that you don't just go into medicine and surgery to do everything. You must have a niche. You must have a place where you focus. All right. So when I go details into this of that of the maybe the function of a cardiologist, you can now clearly tell if this is the area you would want to major in, right? Because in the end you must get a major. So under the cardiologist, we cardiologists are doctors who specialize in diagnosing, treating, and preventing diseases that mainly affect the heart and the blood vessels. And so this is what cardiologists do. They focus on the heart and the blood vessels, right? And so if you are interested in focusing on this part, cardiologists are very sensitive. It's a very sensitive field here because your heart, your brain are two major factors, to your life, to you being alive. I know once the brain is dead, automatically you die. And also, once the heart stops functioning, in no time it sends this signal to the brain and you see that you're off. All right. So this is a very sensitive and delicate part which will require a lot of pain to details, right? So people who are cardiologists treat patients by reviewing and understanding their medical background and examining them to assess health conditions, right? So they do a lot of things. They carry out tests. They go for results. They could even refer you, to another, maybe for a scan and all of that. But what cardiologists do is basically around the heart and the blood vessels. So anything that's outside this, they have no business with it, right? So they are not general doctors, these are specialists. Okay, so that's why if you visit some hospitals, they let us know, okay, if you want to see the cardiologist, come on Tuesdays and possibly on Thursdays. They fix a time, yes, because specialists might not always, right, be available. They might not always be at the spot, and this is the truth. Cardiologists are in high demand, right? The issue of the heart is something that's really important, and I believe even getting close to old age, a lot of people have to, even at a young age, you need to do this heart check. You need to know what's wrong with you and all of that. So cardiologists are really in high demand in every country, and just being a general doctor cannot make you a cardiologist. You must specialize, right? You must specialize in these things, and over the years, after series of practice, after series of training rather, you would be a very good hand in this field. Okay, so the next on our list is the clinical radiologist, right? Just as the name implies, in case you don't know. Okay, another thing I really want us to get from this is that this would not only help those in the medical field, right? It would also help build your register. It's important that you follow through this career path, because along the line you would realize that your register is building up. You would not just go to make some um discussions and you see yourself saying the doctor when you're obviously talking about someone who's specializing with the heart failures and all of that. You get it? So when your registers develop, when you build on these registers, you could easily say, okay, we are going to see the cardiologist, and you don't have to confuse whoever is listening to you to say, cardiologist, what does the person specialize in? Except that person has no idea of these registers. So this will also help a long way to build your registers, and you'll be more specific in your demands and your communication. It will also help you not to be lost when you get to the hospital. You would know exactly where you're going. I remember when I really needed to see I think that was a physiotherapist, right? So on getting to the hospital, I would have just said I was going to see the doctor, but clearly making the receptionist know I was going to see a physiotherapist. I was just sticking to a ward far from the main ward where people are. So just imagine I had no idea what a physiotherapist does or who a physiotherapist is. I would just stay on that queue, and by the time I go in for a check, for to meet the consultant and all of that, I would now be referred back to a physiotherapist. So it's very important you know the name and the registers in medicine, because medicine is it's a course that you let me say, you must patronize, right? There are only few people in this world who do not patronize this course medicine in one way or the other. You just see that you would need them, not basically for you, might be for your family member, for your friend, yeah, and all of that. So you really need to have these registers at the back of your palms, okay? So yes, the clinical radiologists are medically qualified doctors specializing in the use of imaging to investigate, diagnose, and treat a range of clinical conditions and diseases. Yeah, so these radiologists are known to use images, and so they are the ones specialized in these scans, x-rays, and all of that. I think there's a long list of that. We have the CT scan, and CT is computed tomography, right? They also do some fluoroscopy, magnetic resonance imaging, that is MRI. They do the molecular imaging, nuclear imaging, positron emission thermography, that's PET. They also run ultrasounds, and they do x-rays. And so yeah, this is what they basically specialize in: images, body images, right? So for people that want to go for x-rays and all of that, or people who, if you know you're interested in this kind of work, this is the field you have to specialize in as a medical practitioner, okay? So that's what the clinical radiologists do. They work with these images. And so when anybody, when you have an issue, and maybe they cannot easily trace what exactly, okay, they cannot easily trace what exactly is your problem and all of that, they will just refer you to these radiologists. You know why? Because they really want to know what is happening in your system. And talking about what's happening in your system, they would not easily know, maybe a blood, what's that called now, a blood test, right, might not always reveal what exactly your problem is, especially if it's not a blood condition. So they want to know, are there breakages, are there some issues with the joints? Let's see what the heart looks like. Go for an x-ray, go for a CT scan. Let's see what's in your stomach, let's see what's moving. Do you get it? So this is where a radiologist comes in. And the truth is that a good hospital cannot function without a radiologist, because at several interval, I mean, you would want to go for a scan. Even having infections at some point, you would be referred for this scan. They need to really look in and see, okay, what exactly is this? Is this a pelvic inflammatory disease? Is this that? So these people, what they basically do is they help to really see into the body and know exactly what is wrong with you, right? Even if you have a bone issue, maybe you broke your bones, they help to know exactly the position of that fracture, of that injury, and all of that. So yeah, this is what they do. So if you're interested in this field, this is what you really want to see every part of the human body which cannot be seen with the naked eyes. You should go for a clinical radiologist. All right, so yeah, the next on our list, please, if you're getting value, let us know. Just comment and let us know if you are getting value. If you're still with us at the moment, kindly just tell us your name if you've not done so. Tell us where you are streaming live from, and this will mean a lot to us. And of course, do well to like. Okay, so yes, next on our list is general practice doctors. Okay, this is something we should all be like very familiar with. These are physicians, these are just doctors who do the general things which would always likely find in every hospital, right? And so a general practice doctor general practice doctor provide continuing medical care for patients in the community. They are usually the patient's first point of contact, seeing them in a surgery, at their home, within other places, and various settings, right? So they just diagnose illnesses, recommend treatment, and they also do a long thing in recommending you, like maybe referring you rather to a specialist. Okay, so in every hospital you find these general doctors. They don't really have a specialty per se, but they do everything generally. But then when they see, through these maybe through consultations and all of that, they now know that, okay, this is the main issue, we cannot handle this. If it's just a malaria, they could easily prescribe a drug for you to get it. But when it comes to sensitive issues where it will require a specialist, they then refer you. So that's what general doctors do. And the next on our list is neurologist. right? I want to make this very clear. A neurologist is not a neurosurgeon. All right. So being being practicing surgery, being a surgeon, right, would require a special training in surgery. It's not just every medical doctors, right, are good in surgery. And so these neurologists are medical doctors involved in management of condition affecting both the central nervous system, that's the brain and spinal cord, and the peripheral nervous system, right? So yeah, they diagnose, treat, and manage patients with range of diseases, disorders, and all of that. So these diseases may include stroke, headaches, blackout, Parkinson diseases, Alzheimer disease, and other form of dementia, motor neuron disease, epilepsy, spinal cord diseases, muscle diseases like muscular dystrophy, okay, infections affecting the nervous system, brain tumors, right? Okay, so um, this is what they basically do, right? They specialize in this central nervous system, and I think this is another very crucial part of medicine because, like I said, once your brain stops to function, you're as good as dead. Okay, so they really are very, will I say, attentive kind of person. These are people who can really pay attention to details. These are people who are very, would call them experts. You cannot just come into this field of neurology and not just be an expert. So over the years, they go through series of training to be able to handle such a delicate part, because any mistake done in the brain is as good as killing a patient, right? And so they work also hand in hand with these neurosurgeon. Yeah, we're going to go to the part of surgery soon, but these people work hand in hand with a neurosurgeon. For example, you have a brain tumor and there'll be need for a surgery after they've diagnosed, right, and they've seen that okay, you have a brain tumor and all of that. They would then refer you to a surgeon, a neurosurgeon, who would now maybe do the entire process of surgery, right, to help you recover yourself. Okay, so this is what they do. It's focused on the central nervous system, peripheral nervous system, and spinal cord. Okay, yeah. So the next on our list is the ophthalmologist, right? So who are ophthalmologists? Ophthalmologists are medically trained doctors who blend medicine and surgery along with okay cutting edge technology to treat and prevent eye conditions, right? So okay, from my research I realized that an ophthalmologist, an optometrist, and an optician, these three function basically with the eye, but they have their distinctions, right? And so you need to really go into a deep study to know exactly what area you would want to function in, as much as you want to work with the eyes. The eyes is also a very delicate part. That's why I said, you see, medicine cannot just afford to lose patronage, okay? Because they are always, you will always be in need of medical intervention at various points in your life, not basically for you, but even for your loved ones, for those around you, okay? And this is where these persons come in. And talking about the eyes, the eyes is just like the light of the body, right? This is how we see. And so the eyes is a very sensitive part of a human body, and these ophthalmologists, optometrists, and opticians, they specialize in the eyes. They help in eye treatments, they recommend drugs, when it comes to glaucoma, cataract, when maybe short-sightedness, long-sightedness, and all of that, right? These people recommend the right glasses, the right drugs to use. If you would need a surgery, you're also referred for that and all of that. So this is basically what ophthalmologists, optician, and optometrists focus on, right? Okay, so the next we have on our list are the pathologists, right? Yeah. So the pathologist is a doctor who interprets and diagnoses the changes caused by diseases in the body, cells, and tissues. Yeah, so that's what they do. You prevent disease and you treat a range of diseases. So pathologists really do deep study into diseases, right? They help see the preventive measures. They help to also state the treatment, on how to go about the management or treatment of various diseases. This is what pathologists focus on, and so pathologists are needed in labs and various sectors in the medical environment, right? To really go deep to look into diseases, especially maybe this is maybe a disease which is very popular in a society and all of that. They would need a pathologist, to really look deep to help diagnose and create preventive measures, and not just preventive measures, but also create uh, management measures as well for these diseases if it cannot be treated. Yes, so yeah, before we go on a break, I'm going to talk about the psychiatrist. Okay, so yeah, this is a very, a very, I think every part of medicine is sensitive because this has to do with the body, right? This has to do with human body. This has to do with our being alive. Beyond feeding, we need to keep a healthy life. We need to be healthy. We need to, go on with our day-to-day activities all fit, right? So this is another field of medicine. These psychiatrists are medical qualified doctors specializing in the diagnosis and treatment of patients with mental health disorders. The case of mental health is something that, okay, cannot be overemphasized, guys, right? So we have range of mental health disorders, many which are not even known, many which have really been maybe sidelined, something like schizophrenia, right? Over the years, some communities even term you to be a witch, for just undergoing such maybe a phase of a mental disorder, right? So dementia, depression, bipolar disorder, eating disorder, men as many mental disorders as you can tell. These psychiatrist doctors specialize in it, and they most of the time they have specialist hospitals for this, right? They are not really found in the general hospitals. They create a space for this person because these are people with real special needs. They need a lot of special attendance, and in cases where these people are even going out of hand, they are taken in, like they are admitted and are kept in isolated places to make sure that they get the special attention that's needed for them. And trust me, over the years, these psychiatric doctors have proven to be good by helping to manage many mental health diseases we can find in the world today. Okay, so these psychiatrists are really important, and sometimes they work with psychologists, right? Most of the times, okay, they work with psychologists to go deep into all of this and help give adequate treatment to all forms of mental disorders and all of that. Yeah. So the next on our list is, this is going to be the last I'll be talking about, and then we'll go on a short break. And when we're back, we'll look into you know, other career paths still in medicine and surgery. So this is the epidemiologist, right? So guys, just as the name implies, epidemic, it's coming from epidemic, and when it has to do with epidemic, it's talking about a pattern, a new disease, right, which is spreading across, right? So whenever an epidemic occurs, epidemiologists are hired. They are brought to table to really work on this, right? You would not be unfamiliar with the word with epidemics, because I believe in recent times we have seen some around us, right? So but there's a difference between a pandemic and an epidemic. But these epidemiologists could also work, in solving pandemics. COVID was a pandemic because it cut across different sectors of the world, different continents. In fact, it was something that was general. That made it a pandemic. But epidemic is more of in a specific area. You get, maybe in a specific village and all of that. So epidemiologists study the patterns, causes, and effects of diseases in groups of people. Like I said, it's just a particular place. Okay, so that's where they function. They investigate in the source of the outbreak of a disease, how they are transmitted, how to stop and prevent further outbreaks, right? So these people really study deeply into this. So whenever maybe there's an outbreak maybe of cholera, you invite an epidemiologist, right? An outbreak of Lassa fever, we've had series of them even right here in Nigeria, and these epidemiologists are hired, they are brought to table, and like I said, they study the first of all the roots, the source of that outbreak. Then they know how it is transmitted, because beyond knowing the root, we need to know, okay, the quick, how is this transmitted, so that we can even know the preventive measures, right? And then they now study to know how to stop and also prevent further outbreaks, right? So this is what they basically do. So these people at times work as academic. Okay, all right. So I think he said you would study the disease in individual patients and focus on how the disease has developed. And so they also look, what are the other potentials in this disease, what are the other possible things that can come out of this. Is this something which would lead to death, just like COVID came, and it robbed a very good percentage of the world populace, right? The same happened in the time of Ebola and all of that. So you understand that these people really are needed for deep research and study of every form of outbreaks, whether in a country, within a society, and for pandemics across the world, right? Across continents. Okay. So on this note, we'll be going on a commercial break. So we're going to be going on a break right now, and when we are back, we're going to go further into other sectors, other career paths in medicine and surgery. So until after the break, stay tuned, don't touch that dial.
My News TV, giving you a voice. 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 My News TV, giving you a voice.
Hello and welcome back to Career Compass with my News TV. Yes, of course, if you're just joining, I would never be tired of saying what Career Compass seeks again. Okay, so in Career Compass, right, on these various career paths, and how they could easily navigate through to choose and to dictate what exactly they want to study in various courses, right? Yes, so that's what we basically do in Career Compass. We just demystify these courses and take away the stereotypes which are always in place. Okay, and we've been going through a lot of career path in medicine and surgery, and we're going to be going into the part B of this wonderful course, medicine and surgery. I must say it's a really wonderful course, right? And so right away we're going to be going into okay, let me just give. Okay, yeah, the anesthesiologist, right? Yeah, anesthesiologist. I'm really sorry if I'm not giving the best pronunciation to this, right? Please pardon me. So what did they do? These are medical professionals who takes care of patients before, during, and after surgeries, right? Or complex medical procedures. And so these people are like the forerunners of surgery, I must say, right? So if you see movies, guys, you would see these anesthesiologists very, very well, because they are always on the scene before surgery. You see them, they come to keep I think there's something called, if I'm not mistaken, right? It should be there. The scissors and all those things that are usually used for surgery, right? They even maybe they bring in the patient, arrange like everything to be in order, so that once these surgeons come in, everything are neatly kept at the right places, and then there are no obstructions through the process of the surgery. And so without these anesthesiologists, a surgeon cannot work. Yeah, a surgery cannot even hold, because these people have been, they know these entire equipment. It's their specialty, okay? So they must have read through the profile of the patient and all of that, and know exactly what they're going in for. So like I said, this is not just done during, it's also done before the surgery. During the surgery, they provide these assistance aids. You could not just bring in a an intern to just help out in the surgery without these anesthesiologists in seat, like on seat, right? They are highly needed during these surgeries, right? And then after surgeries, there are cases where there are complex issues after surgery and all of that. These people also come to play in such areas, right? So they said if the role extend beyond the operating room, they are responsible for the pre-operative assessment of the patient and evaluation process. They are carefully considers both the patient's current state of health and the planned surgical procedure that allows the physician and anesthesiologist to make judgment, right, about the safest anesthesia plan for each individual. So like I said, these people are really crucial. They even run kind of a consultancy, right, with these patients to know everything they need to know, so that there is not going to be an accident in the operating room. Okay, yeah. So if you are interested in this, there are people who are into medicine, and they really love to see that everything is in order. They really love to see that there are no mistakes in surgery. They really love to see that there is this news spreading that we're having a declined rate of medical performance. The expertise in Nigeria might be on a decline at the moment. So this is a call for as many who are medical students, right, to sit up, and master whatever field you're going to venture in, right? If we're going to have very successful surgeries, we would need very good, experts, in anesthesiology, so that they could work hand in hand with a good surgeon to see that these operations are successful. I was about to say free and fair, but successful is the word, right? Yeah. And so the next on our list is the pediatrician, right? As you know, they deal with children, right? So they are doctors of children. I really love pediatrists. If you see them, a real pediatrist have grown to love children. They've grown to communicate with children. They've grown to give children joy, right? Like, if you go to a good pediatric hospital, right, you're going to see that even the aesthetics around the hospital is something that attracts these children. And so, going to maybe a cancer ward in a pediatrics hospital, it's so beautiful that you see these children passing through this painful process of chemotherapy are enjoying an aesthetic view. They are enjoying the state of art, the beauty and everything, and it helps a lot in the healing process of children. And so these people specialize with children, and children have a range of illness, but to come to a point where you can easily say go here, go there, they would need to pass through this pediatrician, because these bones are really flexible. These people are really, in fact, they are in a stage where they might not exactly know what they are going through. So these pediatrists know how best to communicate with these children to bring out the real deal they want from it. And one very beautiful thing about this, you would always see them smiling, right? Yes. So I don't think you can be a pediatrician, right, with a very tight face, because I mean children need to love you. You see some of them smiling and injecting a child, and this child is just looking, and you know they would not easily even remember what's going on around them, and they're not crying after an injection, because this is a real specialist in this. Do you get it? So this is a very important field, and there are some child-related diseases, child-related infections, which should be referred to a pediatrician, right? And from the table of the gynecologist, right, which we'll be going into very shortly, if a child is moved from when he's born over to the specific, to a specific part of medicine, which is the pediatrician, right? Because these are the people who deal with these children. Some children are born with disorders, right? And these pediatricians are people who really go in to study this and know exactly what is wrong with a child. Do you understand? I believe you do. So yes, the next on our list, like I said, is the gynecologist, right? So as we should all know, the gynecologist concerns with the care of pregnant women, not just every lady but pregnant women. They are also called the obstetrician, and they are in charge of monitoring the pregnancy before birth too. They work with pregnant women, and we're in a world where antenatal is not something that is uncommon, right? So pregnant women normally go to the hospitals for antenatal, where they are educated more about the status of the child, about how to take care of themselves, how to take care of the unborn baby, and even after birth, how to really bond with your child, how to attend to the needs of your child, how to know, okay, this is a teething problem and all of that. So they've really studied a lot about pregnancy. They've had series of training on pregnant women, and they are always ready, to offer care. Some of these gynecologists go as far as keeping fit, in order to take these pregnant women, like join them in exercise sessions, right? In all these fitness sessions, to make sure that these pregnant women are fit, right? To be able to give birth to maybe the twins in their stomach, the child in the stomach, triplet, and what have you, as many as can be in the stomach of a woman. Okay, the next on our list is the dentist. And just as I'm smiling, right? I'm sure you can see what the dentist does. The dentist takes care of the dentition, and dentition has to do with your teeth, right? Your teeth is really important, right? It's, how do you eat? If you're without teeth, you might have to be drinking, and at some point you'll be tired of drinking. And anybody who has gone through a problem with the teeth can literally relate with how painful that can be, right? And it's not a time to think about. Like, it's not something to even wish your enemy, right? And so this is what they specialize in: teeth. Anything that has to do with the teeth problem, you need a teeth. Maybe you want to take out a teeth. Maybe you're having hole in the teeth. Maybe you're having a diastema, right, which is affecting you, right? Diastema, in case you don't know, are gap tooth, right? Yeah, or this this is where you're gonna find yourself. I happen to know someone who is studying this. She's currently working to be, she's being trained rather to be a dentist. And she said something. She said whoever she was going to get married to must have good dentition. You see, they've so studied the teeth and seen how much the teeth can even affect your entire system. Some of these bacteria, fungi that affect us, some of these typhoid we have, are because of these decays in the teeth, these things that are residue in the teeth, which we do not take proper care of, and they just metamorphose into something that we don't even expect after we swallow them into our system. And so the teeth is a very vital part of the body, and this is what they are here to do for us. Yep. So next on our list is the forensic medicine. These might not be so popular in a country like Nigeria. I must be really honest with you, right? But they really work well in many countries, especially the first world countries, right? So they deal with application of medical knowledge to an investigation, especially crimes, right? In cases where you're trying to know the cause of a person's death, or just in any form of crime, poisoning and all of that, you bring in the forensic medical doctor to really go deep, right, to know what exactly is the cause of the death, what exactly is the poison in that, but maybe in the person's system, was it a food poisoning, or was this just a normal death, and all of that. So this is what they do. And then these forensic pathologists, from my research, carry out both investigation even in people who are alive. Like I said, it could just be a poison which will not take your life, but they go in to study your blood, to study as many things as possible, especially if it is crime related, right? To know exactly what's up. The next on our list is the dermatologist, right? So yes, so the dermatologist is a medical professional who specializes in evaluating patient skin. Dermatologists basically, sorry, have to do with the skin. Anything skin, anything skincare, and all of that, you call in the dermatologist, right? And these dermatologists work hand in hand with surgeons at some point in cases of skin cancer, right? Sorry, oncologists. I mean, they work with oncology because the oncologists, let me just say it now, specialize with skin cancer, skin diseases, and all of that too. So sometimes they also work hand in hand with these oncologists in time of skin cancer. So oncologists study could specialize in various kinds of cancers, right? But these dermatologists come handy when it comes to skin cancer because they've studied the skin and they could easily, prof- um, prefer treatment, right? In such cases. Okay. The next is something that we should know is the plastic surgeon. Yes. So the plastic surgeon, like we all know, is a doctor who performs constructive surgeries, right? They typically help patients with birth defects, sorry, or after injuries to change their appearance. As a plastic surgeon, you may choose to specialize in performing craniofacial surgeries, which puts focus in reconstructing the face, including the skull or parts of the mouth. You may also choose to work exclusively with cosmetic procedures such as breast augmentations and all of that. Okay, so surgeries, plastic surgery, the face surgery. We see some celebrities, especially Western celebrities, they do this face surgery, maybe to change one defect in the face or the other, or you come with a bed defect, or some people through maybe accidents and injuries, there's a bend in their maybe their skull and all of that. This surgeon, people who specialize in plastic surgery, help to bring this is a very vast field of its own, right? So surgeons actions, right? Yeah. So this is the difference between a normal doctor and a surgeon. A surgeon performs operations, they carry out operations to repair, remove, or replace a damaged part of the body, right? Yeah. So it will be very interesting for you to know that there are different areas of this surgery, right? So we have the cardio cardiothoracic, if I'm not mistaken, surgeons. They deal with surgical treatment inside the chest, generally addressing conditions of the heart and the lungs. All right, so we have the general surgeons, a range of, okay, they just deal with the general kind of problems, stomach, small bowel, liver, and pancreas. So they deal with a whole range of the body issues, but they perform surgery, like I said, they operate, right? And we have the neurosurgeon. I talked about this when I was talking about the neurologist. So yes, these people perform surgery on elements of the nervous system, including the brain, the spinal cord, and the extracranial cerebrovascular system, right? So we have the oral and maxillofacial surgeon. They they diagnose and treat patients with diseases affecting the mouth, the jaw, the face, the neck. Yeah, we have the pediatric surgeon, yeah, and like I said, this has to do with babies and all of that. So these are surgeons that work the same work with pediatrics but with babies. We have the plastic surgeon, like I've explained. We have the trauma and orthopedic surgeon. I talked about orthopedic. Okay, orthopedic. I don't think I really talked about that. So this has to do with bones, right? This has to do with joints, the muscles, the ligament, the tendon, the nerves, and all of that, right? Yeah. So we have the urology. Urology speaks problem of female urinary system and male genitourinary tract, right? So this is what they do: the kidney, the uterus, the bladder, and all that kind of thing. They perform surgery around those areas, and I think they would do well in cervical treatment of cervical diseases, right? So we also have the orthohinolari. Wow, this is really long. Orth- Orthohinolaryng otorhinolaryngologist. I think you should really forgive me for this, but whatever this is, they are known for the ear, the nose, and the throat treatment. So that's where they conduct their surgeries in, right? Both in adults and unborn babies. Yes, so as we round up other fields in this, we have academic researchers, like I said, they conduct researches and all of that. We have those who can lecture, right? These medical doctors need lecturers who have passed through that field, right? So you can get a lecturing job. Maybe you love everything about medicine, but what you love to do is to teach. You could get a lecturing job in medicine. We have clinical scientists, we have health service managers, we have higher education lecturer, we have international aid workers, we have medical sales representatives, we have medical science liaison, we have medical journalists, health journalists, yes. So it's another field. We have the physician associates, we have the research assistants, we have the scientific writers, we have the toxicologists, and the rest of them. All right, guys. So if you were interested in medicine, you can click the comment section and let us know which area of medicine interests you, which area you really want to venture in. Like I said, share this content with as many who are interested in these, as many that are even jam bites, for them to know exactly what they're about to venture in. Okay, and like this video. Your reactions are highly needed. Comment if you've not done so. And at this point, I'm going to be opening the curtain for the next session. And so if you're listening at the moment, we're going to work with the highest vote. So quickly click on the comment section to let us know what course you would want us to discuss in our next program on Career Compass. So whatever course you want us to discuss, we are open to any course. So the course with the highest vote gets it. So get your friend, get your family members, get as many as possible to recommend the course you want to be recommended, and we'll give you a special treatment in our next meeting. Until we meet again on Career Compass, I remain Claire Ijoma of My School News TV. Ciao.